Why don't we offer pinoplasty to patients under the age of 18? Yeah, so it's quite common to have pinoplasty in patients under 18, pinoplasty being prominent ear correction. Simple reason is that we can't because of the CQC. So the CQC will kind of approve the clinic, or they kind of inspect the clinic, and when you register with the CQC, you have to say what you're doing and who you're treating, and specifically whether you're going to be treating children or not. And if you say you're going to be treating children, there's an awful lot more work to be done, and staffing, and it's quite difficult to get approval to treat children, to the extent that the hospitals are actually struggle to get this approval sometimes. So it is quite difficult to get this approval. And when I look at the amount of work that we do at the clinic, there's only a minority that would be children. Pinoplasty would be one, maybe moles and cysts. People have talked about tongue tie and things like that. So there are a few cases that might be there, but it really is a minority of the sort of thing that I do, because most of the work is on adults and over 18. So it just wasn't worth us going through the what would be needed to treat children. So that's the only reason we don't offer pinoplasty, or indeed anything. We don't offer any kind of procedures or treatments to people under the age of 18. So you would have to go to the hospitals, and as I say, they're making it more and more difficult to treat under 18s. But we don't do it. So that's it. Not because of any sort of ethical thing or anything like that. I think it's perfectly reasonable to have a pinoplasty under 18. In fact, often you have a pinoplasty 6, 7, 8 years old is kind of a normal age for a pinoplasty. Kind of when you want you really want the patient to start asking for it. So that's kind of the criteria for pinoplasty. So they tend not to do it on really young children who don't feel that they've got a problem. But if they are having problems at school and things like that, I think it's perfectly reasonable to